Good afternoon. I'm Stacy Leeds. I've spent the better part of my life as a legal advocate, as an attorney, as a trial and appellate court judge, a law professor, and then 7 years as the dean of the University of Arkansas School of Law. I also serve as the board member for Arkansas Children's Northwest. I was recently asked to conceptualize and then fill a new role, Vice Chancellor for Economic Development at the University of Arkansas, leading our institution's efforts to increase our economic and social impact within the state. We think that by focusing and expanding innovation, and by creating new business and partnerships for nonprofits across Arkansas, we will play a key role in elevating the vitality of all Arkansans. What I quickly came to appreciate in this new role is that economic development is a mosaic. It has about 1,000 critical and interconnected, imperfect pieces that we know of, and then it's followed by countless imperfect and unconnected pieces that will be revealed to us at some point in the future if we truly listen. As most of you appreciate, healthcare delivery is a critical part of that big picture. But there is also a great value in understanding the complexities of how our economy, legal system, and healthcare interface with one another, and most importantly, how those components can no longer be discrete, isolated issues. When it comes to doing what is right for children and creating a healthy and safe development pathway, the economic and legal complexities of a child's reality and the reality of our state as a whole must be considered. As a state, we have some tough challenges. First, take a look at this map. This is a map of the Millikan Institute's State Technology and Innovation Index. As you can imagine, innovation is critical to any long-term economic growth in metropolitan areas, in states, and also in regions. It's no coincidence that Arkansas is ranked 49th in this Technology and Innovation Index. We are also at the bottom in terms of adults with 4-year degrees, and we have the lowest percentage of holders of graduate degrees in the nation. We also rank in the bottom 10 for measures of child well-being. Everybody sees Arkansas in this regional map. When I see this map, I see a gateway. If we can, as leaders of our state, we can commit to doing something different in this next generation. And if we can do so, we might just turn the tide for our state. Simply said, Arkansas is poised to accept a way forward, but it begins by us creating a healthier tomorrow. Now the next image. Here is a scene what I anticipate that most of you would envision if I asked you what a children's hospital can do to impact a child's health. Why am I showing you this? Well, what if I told you that the traditional healthcare delivery picture only really accounts for about 20% of the factors that contribute to a child's health and well-being? Only 20%. So what then makes up the other 80%? Child well-being is a composite picture of physical environment, health behaviors, social and economic factors, and clinical care. To be more concrete, health is impacted by the food that we eat, the space we inhabit, our education, income, and our safety. All of these factors play a role in our overall health. And for a child who is particularly dependent, the role of these factors for the caregiver and the child are duly important. So what do these graphics have to do with one another? As a pediatric healthcare advocate, I'm keenly aware of the steep challenge we have in improving children's health in Arkansas. As I said before, we rank in the bottom 10 in practically every child well-being statistic that's measured. Creating a healthy future for the next generation will require us to focus on the whole child and the whole family in ways that we just haven't done before. And yet, as an economic development disciple, I'm really convinced that the way that we can do right by our children is to give them the promise of health. Our entire society's vitality will improve, and we will unlock that gateway to a new reality for kids and for our state. On that note, I'm thrilled to be here with you today to highlight a program and a partnership that I think demonstrates what's possible if we turn the lens of innovation to a wider set. 7 years ago, Arkansas Children's, Legal Aid of Arkansas, and Walmart partnered in a way that changed patient families and how they're engaged in conversations about health. At its core, a medical legal partnership, referred to as an MLP, integrates legal professionals into the healthcare setting for the purposes of helping those families navigate complex legal issues that affect their child's health. In much the same way that a doctor might refer a patient to a physical therapist or a cardiologist, or to get an MRI, the patient's care team now includes a legal advocate as well. When done well, the patient experiences one care team, most concerned with his or her overall health and well-being. But to do that effectively, MLPs require close partnerships in a host of providers. It takes doctors, nurses, social workers, legal advocates, and now pro bono attorneys volunteering their time. In an innovative partnership like this, it means that doctors are the ones that are asking those threshold questions that might unpack potential legal issues. And it means that lawyers will be walking the halls of the hospitals on a daily basis. Why does this matter? Take a child who has asthma or allergies, for instance, and think about all the factors that affect that child's health. Medical care and prescribed treatment, of course, but a doctor's visit and an inhaler are only limitedly helpful if that child is living in moldy or pest-infested housing, or if that child doesn't know where the next meal is coming from. In fact, research shows that chronic conditions like asthma and allergies rarely improve without appropriate environmental conditions and without limiting toxic stress. And in some cases, where state laws make it difficult to compel landlords to meet basic standards of habitability in living conditions, or in other cases where public food benefits are particularly difficult to navigate, a legal advocate is critical and is a critical resource in getting us to these solutions. By helping families navigate a host of social determinants that are organized around law and regulatory infrastructure, we further realize the health potential of the child. 7 years ago, Arkansas's Children, Legal Aid of Arkansas, and Walmart took a bold step and expanded the way we deliver health care by entering into a medical legal partnership. 7 years ago, we said yes to health and yes to innovation, and that's the gateway to progress. And it is making a difference. But it did not start and continue to making progress by working alone. As the law dean, I would frequently meet a new person on an airplane or at a reception, and as soon as they figured out what I did for a living, they would retort, "Do we really need more lawyers?" It's okay to laugh. As a matter of fact, we do, especially here in Arkansas. In addition to the rankings that I shared with you earlier, we rank dead last in the United States, even behind Puerto Rico, in the numbers of lawyers per person. The national average is 4 attorneys per 1,000 residents. Arkansas's ratio is half of that, 2 attorneys per 1,000 residents. And in the 25 most rural counties in Arkansas, the number is closer to 1 attorney per 2,000 people. Accessible legal resources for our families are sorely needed. Legal Aid of Arkansas is invaluable in helping to fill this access to justice gap, but they are limited in terms of resources and boots on the ground. Walmart, on the other hand, has an in-house legal team that is larger than any law firm in the state of Arkansas. A tradition of pro bono service is ingrained in their culture, and they truly are a gift to the people of Arkansas. It is my sincere pleasure to welcome to the stage the leader who's responsible for spearheading Walmart's pro bono contributions to the MLP program, and she's going to talk about how this program has transcended organizations and created significant impact. Please help me welcome a true advocate for children, Senior Associate Counsel for Walmart, Sharon Dent.
Good afternoon, and thank you. I'm honored to be here this afternoon. Let me start by saying thank you to Marcy and to John for celebrating the millions of associates who together have reached the $1 billion mark in funds raised for children's health through Children's Miracle Network hospitals. This milestone moment represents decades of tireless effort from associates across the continent who are committed to changing the lives of children, most of whom they will never meet. It is indeed a special day, and this is a perfect way to celebrate. For more than 40 years, Walmart and Arkansas Children's have found inventive ways to take care of children and help people live better lives. We found solutions together through our partnership in CMNH, in school-based dental outreach programs, and in constructing the nation's newest children's hospital, Arkansas Children's Northwest. And in 2011, as Dean Leeds mentioned, we established a medical-legal partnership to help families more fully address their medical and non-medical health needs. This partnership was the first of its kind between a large corporate legal department and a major hospital. And it focused Walmart legal department's pro bono work on the medical legal partnership. In 2017, the National Center for Medical Legal Partnership awarded the Arkansas Children's MLP one of 2 outstanding medical legal partnership awards. This success would not be possible without the facilitating partnership of Legal Aid of Arkansas and its executive director, Lee Richardson. Lee, please stand. The partnership was a leap, a shift in approach based on critical needs we identified, and it required both Walmart and Arkansas Children's to be innovative and think differently about long-standing and systemic problems that affect health. Most of the work of an MLP focuses on 5 categories of needs that require navigating the legal system or legal advocacy. These categories include income and insurance, housing and utilities, education and employment, legal status, and personal and family stability. Our work at Walmart for the MLP is limited to issues involving Medicaid benefits and services, special education rights, and adult guardianships. While there is still much work to do, the partnership has made meaningful contributions that have changed families' lives. I'm proud of our joint work. Since 2011, more than 150 Walmart associates and legal advocates have assisted Arkansas Children's patients and their families. Last year alone, the Walmart team volunteered more than 500 hours of service. The MLP program as a whole has opened and closed 1,500 cases and helped families to address a myriad of legal issues that have allowed them to break down barriers to better health. The numbers are impressive and demonstrate a tremendous need. But what stays with me day after day as we continue to do this work are the faces and stories I learn about from our team. One of the first cases Walmart worked on with Arkansas Children's improved the quality of a little boy's life. Let's call him Joey. As a toddler, Joey had underdeveloped limbs, the result of a birth defect, and was disqualified by Medicare to receive a motorized wheelchair because it seemed that he might not be capable of operating it. Arkansas Children's doctors and physical therapists worked with Joey, and video was recorded of him using the device. Once the video was sent to Medicaid, the motorized wheelchair was immediately approved. I also think about Tyler and our two attorneys who had the honor of working with his family. Tyler was a healthy, typically developing child until he suffered extensive brain damage from intentional injury. He was adopted out of foster care, and his mother has managed his medical needs for nearly his entire life. Fortunately, she has a care team and legal advocates to help navigate the complexities of benefits and guardianship. Two of our Walmart attorneys developed a close relationship with the family, and on a particularly difficult day, those attorneys drove from Northwest Arkansas to Little Rock and back to be with Tyler's mom, to be sure she knew she is not alone and there is a whole team of clinicians and attorneys on her side. And finally, I think about the children with autism and learning differences who we've served together. Through our work with these families, we have been able to help parents and therapists reach agreements with school officials on individualized education plans to ensure that our patients, our clients, get maximum exposure to a regular classroom with students their own age, while also receiving individualized services to keep them on track. This is the difference we make together. In addition to impacting families one by one and establishing trusting relationships with patients and their families, we've had tremendous success creating a cohesive partnership between attorneys and doctors. At Walmart, we are committed to finding new ways to allow people to live better. And I am so encouraged that we found a long-standing partner like Arkansas Children's, an organization that is ever questioning what more can we do for children. We still have a long way to go, but we are making progress. Just 2 years ago, Arkansas Children's implemented a social determinant screener in its primary care clinics that asks questions about housing, food security, education, and other non-medical needs. The power of the screener is that it creates a replicable process and integrates the social determinants conversation into the clinical experience. Since the screener was implemented, we have completed 17,500 screeners, 1,200 of which identified a need that required MLP resources. Because of this partnership, families now experience Arkansas Children's as a place with a team that cares for their whole child and is able to provide resources for multiple aspects of health, not just healthcare alone. Sure, sometimes MLP work is in managing crises and trauma, and yes, sometimes our work requires going to court. But so often, by intervening early and starting the conversation, we find preventative solutions. The work of our team is simple. Remove legal barriers to good health outcomes. Use advocates who know the system and go where patients need us. To increase our impact and properly meet the needs of more Arkansas families, we will need to grow our presence, recruit more pro bono attorneys, deepen our capacity in training and resources, and advocate for solutions to solve systemic issues. If we can find ways to expand, we will help deliver on the promise of a healthy future for children and families, patient by patient, city block by city block, community by community. I am proud of the work of our team, and I hope you will find a way to join us in this mission. Thank you.